Bruxism Part 2. Here we are going to see clinical features and some treatment. Clinical features. Mainly it produces effect on the dentition, effect on the periodontium, effect on the masticatory muscle, effect on the TMJ, head pain, and psychological and behavioral effect. In effect on the dentition, it produces attrition, abstraction, like that. Effect on the periodontium, it produces gum recession and tooth mobility, like. Effect on the masticatory muscles, it produces pain on the masseter and temporalis muscle mostly. Effect on the TMJ, it produces pain in the TMJ and unable to open the mouth and closing the mouth, and produces head pain and produces psychological and behavioral effect. So clinical features is very important in bruxism. Here the healthy teeth and the effect of the bruxism showing attrition, abstraction and gum recession. These are the important oral features in bruxism patient. When the habit is firmly established, severe wearing or attrition of the teeth may occur. Not only occlusal wear but also in interproximal wear produces sensitivity. As the bruxism continues, there may be loss of integrity of the periodontal structure, resulting in loosening or drifting of the teeth or even gingival recession with the alveolar bone loss. TMJ disturbances are also reported to occur as a result of the traumatic injury of continuous tooth impact without normal periods of rest. Hypertrophy of the masticatory muscles, particularly the masseter muscle, may interfere with maintenance of the rest position, cause trismus and alter occlusion and the opening and closing pattern of the jaw. Finally, while it has been suggested that bruxism may give rise to facial pain and headache as well as the psychological and behavioral effect, there is very difficult manifestation to evaluate and tolerate. These are the important features of the bruxism. Treatment. Occlusal approaches. Oral appliances may reduce bruxism, muscular activities and myofascial pains. Oral appliances prevent tooth wear and injury and perhaps reduce nighttime clenching or grinding behavior rather than altering a causative malocclusion. These appliances are worn every night by bruxers. They can protect dental surfaces and relax masticatory muscles. They give not permanent treatment but they protect the dental surfaces and relax the masticatory muscles. Behavioral approaches. Nocturnal alarms have been used to treat bruxism. Typically, these devices monitor masticatory electromyography activity or sounds. When the activity exceeds a threshold for a given period of time, an alarm sounds and wakes the bruxer to terminate the grinding or clenching behavior. Because sleep is disrupted, patients who use nocturnal alarms may report sleepiness and difficulty in concentrating if an alarm is being used. Discontinuation of the alarm may lead to rebound in the level of the grinding. So these alarms are only temporary use only. They are not giving any permanent solution.